Good day, everyone. This is Wilma Niere, and today I will be tackling about the natural methods of contraception, the abstinence calendar method, and the basal body temperature for you to have a knowledge or awareness um what are the natural ways of contraception you will be going to use in the future or today. So, the objectives at the end of the discussion, you will be able to know what are the natural methods of contraception, to know the purpose of these methods, and to know the advantages and disadvantages in using the following methods. Definition of terms: contraception, a term given to prevent pregnancy or conception. Oral sex involves using the mouth, lips, or tongue to stimulate the penis, vagina, anus of a sex partner. Vagina, Vaginal sex is a sexual intercourse, a sexual activity typically involving the insertion and thrusting of the penis into the vagina for sexual pleasure, reproduction, or both. Anal sex is a term used for any sexual activity that involves the anus. Ovulation is a phase in the menstrual cycle. It occurs at about day 14 or 28-day menstrual cycle. Cervical secretion is a fluid or gel-like discharge from the cervix. Gynecologic disorder is a condition which affects the female reproductive organs, namely the breast, and organs in the abdominal and pelvic area, including the womb or the uterus, ovaries, fallopian tubes, vagina, and the vulva. So, what is contraception? As I said, contraception is a term given to prevent pregnancy or conception. It is also known as a birth control or fertility control. What is natural methods of contraception? Natural methods of contraception are considered as a natural way to prevent from pregnancy since they are not mechanical and not a result of hormone manipulation. It is a way to prevent from pregnancy without the use of medication or physical devices. These concepts are based on awareness and observations about a woman's body and menstrual cycle. So, in the next slides are the methods of contraception, the abstinence, calendar methods, and the basal body temperature. So, what is abstinence? Abstinence is from the words abstain to refrain having a sexual intercourse or to avoid. Abstinence is a natural method that involves refraining from sexual intercourse. It's either oral sex, vaginal sex, anal sex, or genital to genital rubbing with another person. Abstinence is the most effective natural birth control method with ideally 0% fail rate. Since it is no sex, it is the best way or the best method in natural ways of contraception. And it also avoids you to have a STI or the sexual transmitted infection and the HIV or the human immunodeficiency virus. So, to make the abstinence effectively, here are the tips or the methods. First is set your own limits and feel good about your decision. Be happy on your decision that no sex or not having a sexual intercourse. Then believe that having sex is not something to do because everyone is doing it. Like sex is not your priority, not because everyone is doing it, or it's not your priority to try it now. Uphold your personal, religious, or moral beliefs. Accept that you can enjoy intimacy in a variety of another ways. Like you can enjoy intimacy, for example, in having a date, going out with friends. It's also a kind of pleasure. The advantages of abstinence is it's natural. It does not kanang nagaput og any chemical in your body or devices to prevent pregnancy. Prevents pregnancy with 100% effectiveness. So since it's a no sex, so it is more effective than the other. No medical or hormonal side effects. Less likely to become infertile since it is natural and no cost. Disadvantages: relationship conflict might occur since you cannot do the sexual intercourse with your partner and can be difficult to practice, especially when you are in a romantic relationship. It is hard to apply abstinence when you have your partner which is addicted to sexual intercourse. It is hard. Next is the calendar method. Calendar method, or also known as the rhythm method, is considered a traditional method of family planning. Calendar method is most effective when you combine it with another fertility awareness methods like the basal body temperature and the cervical mucus methods. So, in using the calendar method, here are the things you should do. First is track your menstrual cycle for 6 periods or 6 months. Mark the first day of your period, then mark the first day of your next period. Determine the length of your shortest menstrual cycle. Determine the length of your longest menstrual cycle. Plan sex carefully during your fertile days and update your calculation every month. Here also a standard days method, the modern one in calendar method. First is count the days in your menstrual cycle on days 1 to 7, on days 8 to 19, on days 20 to the end of your cycle, and then when you get your next period. And to help you track your period, you can also use cycle beads or color-coded strings of beads that allows you to identify fertile or non-fertile days. When we say fertile, it's the woman to have a tendency to get pregnant. Then the next, the benefits in using the calendar method. It is free and also does not require you to go to a doctor annually to get a prescription refilled or get an implant replacement or being monitored. And it is easy to decide in getting married. Aprings. The disadvantage in calendar method is that doesn't protect you from STI or the sexually transmitted infection, and also with the HIV. You need to consistently track your menstrual cycle for at least 6 months before the method can be considered reliable. You need to abstain from sex or use a backup contraception during your fertile days if you don't have a normal menstrual cycle. Next is the basal body temperature. Basal body temperature method is a technique used in family planning. It is the temperature of a woman's body when completely at rest or after a woman's ovulates. Used to detect pregnancy following the rise in basal body temperature that lasts for 18 or more days may be a sign or indicator of pregnancy. Also often combined with the cervical mucus method of natural family planning by keep tracking of cervical secretion. So basal body temperature is a temperature when a woman is completely at rest or before going out in bed in the morning. To use basal body temperature is to take your basal body temperature every morning before going out in bed or before doing anything. Use a digital oral thermometer or one specifically designed to measure your temperature. Track your temperature reading. Then plan sex carefully during fertile days. In tracking your basal body temperature, it doesn't require any special preparation. But if you want to use this method together with another birth control method, you should consult your health care first if you are in breastfeeding, you recently gave birth, or stopped taking birth control pills or another hormonal contraceptives, or when you're approaching in your menopause period. The factors may influence in your temperature when illness or fever, when you're stressed, shift work, interrupted sleep cycles or oversleeping, alcohol, travel time zone differences, gynecologic disorder, or certain medications. The advantages and disadvantages as it basal body temperature is inexpensive, doesn't have any side effects, and the disadvantage is not accurately predict ovulation in all women, including those with irregular menstrual cycle, and no protection from sexually transmitted disease. Conclusion: when choosing a ways of contraception, you should be careful or aware what kind of methods is suitable for you.